Life is more precious than I ever knew, and almost every day feels like a big deal and still does. I wake up every morning and I'm just thankful that I'm still here, that I've got another day. I call it the extraordinary gift of an ordinary day.
Hi, this is Patrick.
And this is Laura.
And you're listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. National leaders in cancer. If anyone listening today has ever tried to figure out how to pick themselves up time and time again, then you will 100% relate to Cheryl. Cheryl, you are a 3-time cancer survivor, correct?
Yes, that's right.
I think you hold the record on our podcast for the guest with the most cancers.
The club nobody wanted to join.
Yeah, congratulations.
You just kept coming back to the club, right?
Yeah, I'm glad to just be able to keep coming back.
I think what's also really interesting about your story is that without you focusing on your health some 15 years ago, you would have never found your first cancer. Yeah. So I would love to start your story with where you were mentally and physically around 2006 or 2007 when you decided to take control of your health.
My husband and I had both watched all 4 of our parents both die very early. My mom at 59, his mom at 60, his dad at 52, and my dad lived a little bit longer, but not healthy. He had Parkinson's and other issues. And so my children never have a recollection of having a grandparent, or at least a healthy, active grandparent as an active part of their lives. And I decided then and there, if I have grandkids someday, as much as it depends on me, that's not going to happen to them. And so that was the beginning of my weight loss journey. It took me, I think, 3.5 years to lose 100 pounds. I reached my weight goal in January of 2009. And then fast forward to, it was around 4th of July the same year, we were having a family get together, and my sister noticed a lump on my left scapula on my back. And she said, "Well, what is that?" "I don't know. I never noticed it before." And she's feeling around on it. And I said, "Well, I've got a doctor's appointment scheduled coming up, just a regular physical checkup." And I said, "I'll just mention it and get it checked out." The doctor's like, "I don't really think this is anything. It's probably just a fatty lipoma. Look how healthy you are. Look at all the changes that you've made." She said, "But we'll do an MRI and get it checked out." And when we did the MRI, it was not a fatty lipoma. It was non-Hodgkin's lymphoma. The subtype was follicular lymphoma, which it turns out is a type of lymphoma that is very responsive to treatment. But as the doctor explained it to me, I knew that he was very pleased that it was not a sarcoma, and very pleased that it was a type that he said would be very responsive to treatment, most likely.
So because it's an example of how strong and determined when you get knocked down to get back up, we should mention that between your first and second cancer diagnosis, while you were cycling, you were hit by a car and almost lost your life in that accident.
Yes,
correct?
Yes.
And that was in what year?
That was in 2016, actually on my daughter's 22nd birthday.
Oh, no.
And how many...
her birthday.
Yeah.
Yeah.
Jeez Louise.
How many months did it take you to recover from that?
Well, I was still recovering from that over 2 years later when I was diagnosed with my second cancer.
So that second diagnosis is what brought you to Siteman Cancer Center. So
Right.
How did you discover that you had this second cancer diagnosis, and what was different from the first one this time?
The second cancer diagnosis, I woke up in the middle of the night in excruciating pain, having no idea why, but it was in my lower left abdomen. And I thought, I don't know if the ovaries burst or ovarian cyst or something, but it was just pain more intense in a specific location than I'd ever had, even with the accident. The pain, I don't know. I'm a person of faith, and I kind of believe that God sent me that pain to get me to the doctor.
Yeah.
Mm-hmm.
And I noticed a lump actually on my left butt cheek. And I thought, well, that's weird. And I showed that to the doctor when I went about the pain. And I looked back and I saw her face when she saw that. And she knew something was wrong immediately. I could tell by the expression on her face. And so I knew something was wrong there. She sent me for an MRI.
So what did it find? What was the diagnosis?
The diagnosis ended up being, they called it a transformed cancer of my first cancer. So it was still non-Hodgkin's lymphoma, but it had transformed to a different subtype, which is called diffuse large B-cell lymphoma. And it is a much more aggressive, faster growing, scary monster than what the first one was.
So when you were diagnosed with this the second time, were you assuming that you might be able to go through the same type of treatment?
I was hoping.
But that was not the case.
That was not the case. We started down that road with chemotherapy, and the chemotherapy was not working. So my oncologist there referred me to Dr. Cashen.
And you live about 2 hours away.
Yeah, about 2.5 hours from Siteman. I trusted him, so I went to see her, and she indicated that I would need a bone marrow transplant, which is what we thought we were headed for at that time. And she can explain this better than I can, but we needed the chemotherapy to have some impact to be able to go through with the bone marrow transplant. And we tried multiple different types of chemotherapy protocols, and none of them were having the impact that we needed to be able to proceed with a bone marrow transplant. So the next thing that she had up her sleeve was called CAR T-cell therapy, which is a therapy that had only been approved like 3 months prior by the FDA for clinical use. It had been in clinical trials, to my understanding, for maybe about 3 years prior to that.
Hence why we always preach clinical trials on this podcast.
Yes.
Yeah,
Right,
clinical
Patrick?
trials are incredible.
Yeah.
That CAR T-cell treatment is something that my dad was chasing for a while.
Oh, really?
He was in line to do, it was something where he'd go take biopsies and stuff, and they would extract T cells and try to, I mean, you'll be able to describe it much better than me, but
And Dr. Cashen better than either one of us.
And Dr. Cashen will, but yeah, I remember that was kind of like we always referred to it as like our Hail Mary, like kind of, if we could stick around long enough, then that was like something we were going to try to do, but he wasn't able to, unfortunately. No. So, but I'm fascinated to hear that you were able to try this treatment, that it worked for you.
So, yeah, in my case, I was told that this cancer would definitely be fatal without treatment. And by now, the only thing left on the table for me that was being offered was the CAR T-cell therapy.
So what is T-cell therapy?
So what they did was they hooked me up to a machine that's really, it's the same as a dialysis machine, but instead of taking your blood out and sending it through a filter and back in, they take my blood out, and as it's out of my body, they're extracting my T cells, and then the rest of the blood goes back into my body.
And go
then
back
put
in.
them back in you. What I know is very difficult because in my dad's case, it was his density of T cells was always so meager. He'd go in and be like, they got like 9 or whatever. It was just.
Yeah, I didn't have that trouble. They were able to collect an appropriate number. I think it was just one day of that, but it was multiple hours, hooked up to that machine while they collected the cells. But so meanwhile, while the cells are off, getting their special forces training, if we want to call it that, then I'm going through super intense chemotherapy to knock out my immune system so that it doesn't fight against those T cells when they're reintroduced into my body.
So you're super sick when it's time to get the T cells put back in your body. Do you remember what it felt like when they put them back in? Was it like some people have described when they do the bone marrow transplants, they can feel?
The feeling was exactly the same because I've had both procedures, and the feeling was exactly the same. It's an emotional moment because you're like, okay, this is what I've endured all of this chemotherapy for, and you're going, in my case, I'm praying, this has got to work because this is my only shot here. And so, and I know it's risky, but I'm praying. And what I'm feeling in my body is, you can kind of feel it going in, but I ended up and I guess this is common, you can end up getting really short of breath and feeling like you can't breathe and feeling like, your esophagus is closing up. And that's what I experienced both times. And then you panic and then it makes it worse. But once they had oxygen, they're, ready because they know this happens a lot. And once they put that mask on me, I was fine within a few minutes. And then, you're very sick for a number of weeks.
So you're in the hospital for weeks under observation after this. Now you're in an apartment and you still need tons of assistance, obviously. When did you finally get to go home, and what was that part of the recovery like?
That would have been late July 2019 by the time I went home. And I still needed a lot of care. I mean, people think, oh, you go home, you're done, and we brush our hands and we move on, and it's back to normal life. And it just doesn't work that way. There's still a steep curve to get anywhere close to normal again. But what happened after that cancer was I was having trouble having enough. I think it was enough white blood cells, and I had to repeatedly get transfusion after transfusion after transfusion. And this is while I'm trying to work back. And after a transfusion, I would physically feel much better and was able to do more. But then, the farther away I got from when I had that transfusion, I'd get weaker and weaker and weaker. And eventually my oncologist there said, I think we've got another issue here. I need to refer you. He said at that time to a hematologist that he referred me to still locally. And this doctor, she told me that I had myelodysplastic syndrome. It'll turn into a different type of, I don't know if it's leukemia or lymphoma, actually. I think it's called ALL, but it will eventually turn into that, which is my third cancer, and that will be fatal. And that was devastating. And she said the only treatment for this would be a bone marrow transplant. And so I was referred once again to Dr. Cashen, and turns out I'm still here. So apparently I was a candidate for bone marrow transplant. And that's what we did with my brother as a donor and my sister as a caregiver.
Cheryl, what would you say to anybody that's listening that's facing a second, a third diagnosis, trying to just not let it wear them down, or trying not to give up, or someone who's loving someone through it? What could you say to them to make them just get up one more day and try harder or try again?
For me, addressing fear was a big part of it. First, I'll go back to something that happened to me on a bike ride months before my first diagnosis. I lived about 10 miles away from where I worked, and I would often commute by bicycle to work. And where I live in central Illinois, it is flat as a pancake.
Yeah.
And so when it's windy, it is windy. There's nothing to stop the wind. And it's complete farmland between where I live and where I worked. And I had ridden a bike to work one day, and on the way home, the wind had picked up during the day. And I was facing a headwind of about 25 to 30 miles an hour.
Wow.
And I was so mad. I was cussing that wind. I was frustrated. I was pedaling as hard as I could, and I wasn't getting anywhere. And something came to me that I can't describe in any other way than God implanted this thought process in my mind. And that was, Cheryl, you can be mad at this wind all you want to. That's okay. You can do that. But this wind is going to continue to blow. So here's a better idea. Adjust your attitude, adjust your pace, and adjust your face. So adjust my attitude. Okay, I can't control this. I'm going to have to deal with this. Adjust my pace. Gear down. Accept the fact that I'm not going to get home in the time that I usually do. It's going to take as long as it takes, and there's nothing I can do with that. So gear down and find a gear I can pedal in, and just keep pedaling. And this sounds so cheesy, but I found it to be true. If I can smile, just physically force myself to smile. I don't feel like smiling, but if I can actually put a smile on my face, something happens, and it actually does get a little bit easier to pedal. And I noticed that same concept one time when I was running on a treadmill. It happened to be in front of a mirror, and I was suffering and I was struggling. And I looked at myself and I thought, just smile. And I did. And I was like, holy crap, it just got easier to run. Mm-hmm. And so the reason I think that's from God, I thought it was just to get me home on that bike ride. It has been something I have thought about so many times through all the things that I've been through. And what it comes down to is acceptance. Like, okay, this is where I am. I didn't like Dr. Cashen because she told me I was going to need a bone marrow transplant. Well, guess what? That's where I am. And that wind's going to continue to blow. So find hope wherever I can, adjust my attitude, adjust my pace, adjust my face, and just keep pedaling in a gear I can handle. I know people say it so much that it sounds cliche, but I wake every morning and I'm just thankful that I'm still here, that I've got another day. I consider it, just a normal Thursday, whatever. I call it the extraordinary gift of an ordinary day. And life is more precious than I ever knew. And that feeling of each day being a gift has gotten intensified more after each one. I feel that more now than I ever have.
I'm still trying to keep that for myself. I can still feel the mundane slip back in, I'm getting pissed off about slow Wi-Fi or
right.
something like that. I'm like, what? Who the hell cares, man? You had cancer,
That's right. You're still here.
Why
all this other stuff is small stuff.
Yeah.
But you're human, and everybody faces the diagnosis different. They face the treatment different. They face the post-treatment different. They deal with their family different. It's such a club, but everyone is such a unique member of that club.
Yes. And to further expound on that point, we could be very similar people, same age, same, two females the same age, have the same cancer, and our responses and reactions to it would be so different. And I think our treatments in some cases would have to be so different as well, even for the very same cancer, because we're just different not people. The same.
Yeah. Anatomically, genetically, emotionally,
physically,
the wherewithal. I mean, I just, not everybody can, unfortunately, muster that strength to get through three times. I mean, my dad was also very religious, a very faithful person, and I would always check on him and, do we want to try a group therapy thing? Do you want to talk about it? Do you want to follow up on any of these counseling services that Siteman offers? And he was just always, I believed him. He wasn't just trying to put me at ease as my father, but he was like, I'm good. I've got my faith. I've got my family. I'm fine handling this.
I'm similar to that. But when it comes to, the offer of the group therapy and those things, I didn't feel like that would be helpful for me. I don't mean to be disparaging about group therapy. I think it can be super helpful. And I'm not sure I didn't miss something by not doing it.
It's just not for
everybody. But it
it
wasn't where my head was.
Yeah. And that's okay. I know we talk a lot about Siteman offering free psychological services to patients and families, but we even had one of the heads of the department on in a previous interview that said, and for some people, that's not what works. Some people it's prayer. Some people it's activity. Some people it's talking to family. And that's okay, just as long as you're getting something that can help keep you focused on recovery.
For me, that was the hope of a future grandbaby. It was my why. It's why I kept fighting. It's why I kept working. It's why I kept showing up. It's why I kept saying yes to all these treatments.
And can we tell people that?
Can we tell people the news?
We can. On September 15th, just this year, we welcomed our first grandbaby, and it's everything I'd hoped. And I get emotional just at the thought that I'm still here to see her. And I bought her a little onesie before she was born, and it says, Grandma has waited a long time to meet you. And Grandma went through a lot of things.
We should change it to Grandma went through a lot of crap to meet you.
There we go.
Grandma went through 4 lives to meet you, right?
Right.
Man, if that kid ever doesn't show up for like a Thanksgiving or a
Mother's
Christmas,
Day,
I would call and just lay the thickest guilt trip on them.
I went through 3
Do you know how many cancers
I
got hit by a car. I lost over 100 pounds. Get your butt over here.
That's right.
Exactly.
That's right.
Exactly.
Yes.
Well, I think we need to meet Dr. Cashen and talk to her about getting you to this point and ask some of these scientific questions that we all try to answer. But clearly, we like to play doctors on a podcast, but we are not.
There's always a handful of questions that are best saved for the professionals.
Exactly. So let's bring her in. Dr. Cashen, thank you so much for joining us today. You met Cheryl with her second diagnosis, as she mentioned, at Siteman. Can you tell us what you do at Siteman Cancer Center?
So I'm the Associate Chief of the Hematologic Malignancies Service, and with that have administrative roles over leukemia, lymphoma, stem cell transplant. And then in my own clinical practice, I see patients with lymphomas and other blood disorders who are referred for stem cell transplant, clinical trials, CAR T-cell therapies, and then I conduct clinical research in those spaces as well.
So you're not busy.
Right.
I'm curious. To me, something like a stem cell transplant or what else were we calling?
CAR T-cell?
Not CAR
bone
T-cell,
marrow.
but like a bone marrow transplant. Still, and to my mind, sounds so like futuristic, space age, like, just intensive thing. But it is fairly common these days, is it not?
Well, it's always tough to answer because it's common in my world,
right.
And at Siteman,
Not common in mine.
right?
Too common now.
Right, that's right. It's it's very common at a place like Siteman Cancer Center. We're one of the busiest transplant centers and CAR T-cell centers in the whole country, but we get referrals from a very wide area of Missouri, Southern Illinois, Northern Arkansas, Western Kentucky. So an average oncologist out in the community is going to refer patients for transplant pretty infrequently.
Right.
It's just that they come to us, and then we see a lot of patients.
And when you say that you're in hematology is all blood disorders, correct?
Yes, hematology broadly can mean any kind of blood disorders, even ones that aren't cancer. So when we use the term hematologic malignancies to really designate in our doctor speak the blood cancers, which is where my practice sits.
Gotcha. And can you explain to people why lymphoma specifically would have caused the lump in the back of Cheryl's neck and then the lump on her that they found on her buttocks? Why that happens with lymphoma?
Yeah, lymphoma is really a general term that we give to the whole group of cancers that arise from B cells or T cells. Those are a normal part of our immune system, a normal type of white blood cells. And when they turn into a cancer, we call that cancer a lymphoma. But there's lots of different types because there's lots of different types of B cells and T cells in our immune system. But these kind of immune system cells that turn into lymphoma normally live in the lymph nodes. That's where they're meant to be to fight off to fight off infection. And when they turn into a cancer, it often creates a swelling in lymph nodes. But they do travel all through the body, and so they can be in other organs and places outside of the lymph nodes too. But wherever they settle, they grow and create a mass that is a lymphoma mass that needs treatment.
So how long has this CAR T-cell option of treatment been around? Because I had never heard of that either. I knew about blood or bone marrow transplants. I've had several people in my life that have had that done, but I'd never heard of CAR T-cell. Patrick, I know you have, but...
Yep.
Yeah, it's really a remarkable breakthrough in the treatment of lymphomas, and it was not even in clinical trials when Cheryl was first diagnosed with a lymphoma.
You mean the one in 2009?
The one in 2009.
Gotcha.
But we were very fortunate at Siteman to be involved in the phase 1 trials when those therapies started to be used in lymphomas in about 2016. And they worked so remarkably well that the progress to full FDA approval was remarkably fast. But even with that, we were treating our first patients with the FDA-approved CAR T-cell, like what you got, Cheryl, in 2018. So just a year before you received that treatment.
I thought it was even shorter window than that from when I got it.
It was a very very new, newly available when you needed it. And in just a few years previously, if we couldn't have gotten to it on a clinical trial, we would not have had that effective therapy available for you.
I mean, that is just like, when you hear that, Cheryl, that is something that was even an option for you, a life-saving option. I'm just sitting here going, how is this stuff discovered? I'm just sitting here listening to you, and I'm like, that is amazing. How many hospitals in the country would you say are using this as a treatment option?
I don't know an exact number at this point. I do know that when CAR T cells first got FDA approval, the first manufacturer only selected 25 centers across the entire country, and we were one of those. And certainly it's been escalating from there.
I'm just curious about, like, the manufacturer now, like, I'm sure it's so complicated that we couldn't get into all of it today, but I mean, these are just specialized labs that we send off stuff to, like you would for like a biopsy, and they are attaching these
genes or these
genes
receptors
to it. Where are the genes coming from?
So there are now...
We can also just not get into it if it's just too much.
No, if you're happy to talk about that, it is an interesting part of the story is how does a pharmaceutical company develop a drug that's going to be made individually for each patient? It's not, how do they do quality control and have a site that's large enough to handle the volume of samples that need to be processed on an individual case-by-case basis? So there are now several major pharmaceutical companies that manufacture these CAR T cells for lymphoma and multiple myeloma, and many smaller ones that are developing new CAR T cells in clinical trials. And what they do is create these huge manufacturing centers where they have series of small individual labs so that each patient sample can go into its own lab space and be handled by a single technician from beginning to end to keep each patient's sample separated and work to go through all the quality control. It takes 3 to 4 weeks from the time we collect the patient's cells until we receive them back. So there's certainly a time there that we have to wait for that whole manufacturing and quality control process.
When you sit down and you start to think about what science has enabled to treat cancer and how, Cheryl, without that, you wouldn't be here. You wouldn't have met your granddaughter.
Oh, the science behind this all is amazing, and a lot of work went into it. First in academic research centers, and then in pharmaceutical companies who were able to scale it up and run the trials. It's been a huge lift and a lot more work to do. I think everyone's really excited in the field to see where it's going to go next.
So what about genetics? What about Cheryl's family? Is there, I don't know anything about screening or knowing how to see what your risks are of getting that if someone in your family does.
Yeah, like how hereditarily passed on something like this is.
Yeah, that's an important question, and something that we ask about so many cancers that do have a clear family risk for them. But lymphomas are not one of the cancers that clearly track in families. If a family member has a lymphoma history, then you have a little bit higher risk than the general population, but it's still a low risk, and there isn't any routine screening that we use.
And Cheryl mentioned that she didn't really feel much at all the first cancer in 2009, and then 2016 you only felt the pain once, which led you to your doctor, which led you to Siteman. So how does someone know if they might have it?
Right. I, hear so many different stories from my patients on how they finally arrived at their diagnosis of lymphoma or a leukemia. And a lot of it starts with a lot of vague symptoms. I was run down. I had a cold. My doctor thought it was a UTI. We thought I had pulled a muscle. They're pretty nonspecific symptoms unless there's a mass that you can feel. So you get a lump somewhere. That's often what people will notice and take to their doctor, even if they're otherwise feeling okay. Sometimes I've had patients diagnosed with lymphoma because they were in a car accident or they had a kidney stone and they got a scan that saw lymph nodes that nobody even knew was there. So that's kind of a hard answer to give you that, it could be lurking and you don't even know.
Yeah, they seem like jerks, lymphoma
Right.
things. Like you can't screen for them and you can't
Right.
usually sometimes know that they're there.
But at least I can give the positive answer that whenever we find it, whether it's in a single place or it's in multiple places, we have really effective therapies. So again, it's not like those other cancers where you want to catch it before it spreads.
Like pancreatic cancer or something.
Right. This one, it's usually already spread, and yet we still have highly effective therapies, high chance of curing most of the lymphoma types. So trying to catch it early doesn't have the same importance as it does in other cancer settings.
Are there other types of blood cancers other than lymphoma and leukemia, or are they just all subtypes of those two?
Myeloma is the other major category of blood cancers, and I have some really excellent colleagues at Siteman who are on the cutting edge of treating multiple myeloma. In fact, CAR T cells have recently become a standard part of treating multiple myeloma, just like lymphoma.
And what is multiple myeloma?
So multiple myeloma is a cancer that starts in the plasma cells. That's a different category of the blood cells. And it can present with bone marrow involvement, bone involvement, changes in kidney function. And there are specific highly effective chemotherapy drugs and these new kinds of immunotherapies like CAR T cells that can be used to treat it. So they do tend to stay on treatment almost continuously, although, again, at least the treatments are effective at keeping it under good control.
Gotcha. Cheryl, you said you got to tell Dr. Cashen, was it in the last 6 months recently?
Yeah, it was just, in the last month or two when we had our last visit, yeah.
You were able to tell her what we were able to tell her just because you told me this before we sat down.
I was able to... Dr. Cashen, I don't think, knew my whole backstory of what I've been through before I met her, so I was able to fill her in on that a little bit and to explain to her what my why has been through it all, to keep going and to keep getting back up and to keep doing the work every time I got knocked down. And that was, that the hope of someday having a grandchild and being able to be around for that grandchild that I might have someday. And I got to thank her for getting me to the day when I got to meet my grandchild just recently.
And I was very emotional after that meeting with you, and I carried that high and that joy with me for days, and this conversation has just brought that all back to the surface. It makes me so happy to hear that story from you and to celebrate with you the birth of your granddaughter.
Dr. Cashen, thank you for saving our friend Cheryl, not once, but twice.
Absolutely. My joy and pleasure.
And all the things that you're doing at Siteman and continuing to learn and grow about how to treat these cancers. And it's just another example of what a great place Siteman is.
I feel so lucky to work there and be able to treat patients there and offer them the very best therapies in our amazing environment.
Pretty awesome.
Thank you both for being here.
Thank you.
Thank you.
Thanks for listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis.
National leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu and be sure to leave us a review and like and subscribe wherever you listen to podcasts.